Hello, my name is Tasha DeWald, and I'm going to discuss the 8 core competencies for nurse educators from the National League for Nursing. The first one is Competency 1, Facilitate Learning. And how I do this is in my health assessment, different students learn differently, so I provide different ways for them to learn. I will perform the health assessment on another student so that they can watch it. They do practice sessions where they practice on another student, and I'm available for them to ask questions. And then I also print off some character pages for them to be able to remember different health assessment techniques. And then I also discuss real life situations that I've experienced in practice. And then I also do some case studies for them to understand the health assessment and discuss abnormals and normals. And then in foundations, I know that it's hard sometimes to retain content when it's history and theory. And so I do a lot of projects for them. Some of them are art projects for them to help understand the philosophy of nursing. And they do a schematic model. And then they also do a nurse therapist project. And then for my legal class, I do study mates where they can do matching, they can do hangman, fill in the blank, or they can just read through the facts to help them remember and study the content for each chapter. And then it's also a blended classroom, so some of the time they're on campus and then some of the time they're not, and they're doing those study mates. Competency number 2 is facilitate learner development socialization. And how I do this in health assessment is I have the students maintain professionalism when they're in the lab. In each exam room, the doors are closed. They knock as if they're entering a patient's room. And then they introduce themselves and wash their hands just like they would within practice. So that helps them get in the routine of things and keeps them professional even in the classroom setting. Competency number 3 is use assessment and evaluation strategies. And with this, they do their final checkoffs in the lab. And so it's evaluated then. And then in foundations, I do the flipped classroom. And when they do their nurse therapist project, the students pair up with another student. And they study a nurse therapist, and then they present about that nurse therapist in the classroom. So they're the ones that are teaching the other class, the rest of the class, about the nurse therapist. And then they also do an evaluation with that and evaluate their partner that they worked with. Competency number 4 is participate in curriculum design and evaluation of program outcomes. And with this, I maintain my core syllabus and have it reflect the program outcomes and make sure that that stays current. And then I make sure in health assessment that I'm teaching them current health assessment techniques so that they will practice currently in the setting when they go to their clinicals. And then I try to read and stay current about different health assessment techniques that may no longer be used, but I do educate the students on old techniques and then explain to them how some of the techniques like percussion are not utilized as often as they used to be now that technology has come into play. Competency number 5 is function as a change agent and leader. With this, we're revising our curriculum to better organize it and make sure that things are covered. And we had students participate in that and got some feedback from them. So the curriculum is being revised in our nursing program. And then we make sure that we introduce students to new technology and make sure that we're current with evidence-based practice and make sure that we communicate everything that we learn or things that are updated amongst the different faculty. Competency number 6 is pursue continuous quality improvement in nurse educator role. I am on the evaluation committee, and we get together and we evaluate all the tests for each course. And we've done this last semester and we're doing it again this semester. And then when we evaluate the tests, then we give that feedback to the instructor that teaches that course and provide recommendations and make sure that our tests are meeting the qualifications. And then I stay current and updated the course delivery methods. So I'm always trying to incorporate new methods to engage my students and to utilize technology, since the current population uses a lot of technology. So I try to incorporate something new in each one of my courses every semester. Competency number 6 is engage in scholarship. Currently, I'm working on my master's, and so my scholarship isn't where I want it to be, but after I complete my master's in education in May 2015, I have a goal to publish in a nursing journal. I enjoy talking to other faculty that do publish and stay current with what they're doing. I find it very interesting, and I'm excited to be involved in this when I'm finished with my schooling. Competency number 8 is function within the educational environment. I learn a lot from seasoned faculty. I'm always asking questions and always get their point of view in different things, and then we share information back and forth, so we always learn from each other. And then I'm also involved in committees within the department, also the university itself, and then I'm also involved in the community, so I can stay current in everything that's going on and be involved in different aspects of the department, university, and community, so I feel like I'm resourceful with more people that I can use as resources. So that's my 8 core competencies for nurse educators. Thank you.